Okay, my name is Nicole Vetter, and this is my health assessment for Nursing 612 for Maryville University, and this is my patient, Brett. Before we started recording, I asked him to empty his bladder and put on a gown. We took his height and weight. He's 5'7", 200 pounds. We took his vital signs. His temp was 98.3, his blood pressure was 122/64, and his pulse was 70. And his respirations were 16. Okay, so I'm gonna start with the head. I'm just gonna look over his skin. I'm checking for any lesions, rashes, masses that I can see. I'm gonna palpate his scalp, making sure that there are no masses, checking the hair for coarseness or fineness. I'm gonna look at his facial bones, palpating them for evenness, making sure there's no masses there, checking his sinuses, his frontal and his maxillary. Any pressure? No? Okay, I'm also gonna check his temporal mandibular bone joint. Go ahead and open and close. Okay, move side to side. Any popping or cracking or pain?
No.
Okay, we'll also go over cranial nerves 5, 7, and 12. I'm gonna have you clench your teeth for me. Don't let me move your jaw. Okay, go ahead and close your eyes tightly. Okay, wrinkle your forehead, smile, stick out your tongue, move it side to side for me, and puff out your cheeks. Okay, good job. We're also gonna test cranial nerve 5 with sensation. I have a Q-tip here, the soft side and the sharp side. I'm gonna let you close your eyes and you tell me if you feel soft or sharp.
Soft. Soft. Sharp. 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 Soft.
Okay, we're gonna go ahead and move on to the ears. I'm gonna inspect the ears for symmetry on the head, making sure one isn't higher than the other. I'm gonna palpate the auricle, making sure there's no pain, tenderness for the patient, also making sure there's no masses present. I'm going to look in his ears, in the ear canal, checking to see if there's any redness or irritation. I want to be able to see the temporal membrane. It should be gray and pearly, translucent, and I should be able to see the landmarks and the light reflection, which I do. We're also going to check cranial nerve 8 with the whisper test. So I'm going to have you cover your right ear, and I want you to repeat what I say. 1, 2, 3.
1, 2, 3.
Okay, do the same with the left.
ABC.
Okay, good job. We're also going to use our tuning fork here to check your hearing. Okay, we're going to do the Weber test. I'm going to put this on top of your head. This is checking for unilateral hearing loss. I want you to tell me if you hear it more in one ear or the other, or in both.
Both.
Okay, now we're going to do the Rhine test. I'm going to put this on your mandibular bone. I want you to tell me when you stop hearing it by saying now. Then I'll move it forward, and you're going to tell me when you stop hearing that by saying now.
Okay.
This is checking bone conduction versus air conduction.
No. No.
Okay, bone conduction, well, air conduction should be twice as long as bone conduction, which it was. Okay, I'm going to go ahead and do the eyes now. I'm looking at symmetry, making sure his pupils are round and equal. I'm looking to make sure there's no exudate or drainage. I'm also looking at hair distribution on his eyebrows and his eyelashes. I want to make sure that the hair from his eyelashes are coming out and up, which they are. I'm going to look at the sclera to make sure that it's white, and I'm also going to check the conjunctiva to make sure that it's pink and moist and that there's no lesions or nodules in there. I'm also gonna have him do the Rosenberg test. I want you to hold this about 12 inches from your face. Go ahead and cover your right eye. Okay. I want you to read from right to left for me.
D, C, E, F.
Okay. Go ahead and change hands there. Cover your left eye. Read from left to right.
F, E, D, C.
Okay. We're going to check for accommodation. I want you to look past me, find a focal point, and then look back at my nose, and then do the same the other way. Back at my nose. We're checking to make sure that the pupils are round and equal and that they accommodate for shortness of vision. We're also going to check your pupillary response, okay, direct and indirect. So I want you to look at my nose, okay, direct, indirect, good job. Next side here, direct and indirect, good job. Okay, we're also going to check cranial nerves 3, 4, and 6 by doing, checking the 6 cardinal fields of vision, of gaze, sorry. So I want you to focus on my pen and keep your head still. You're just going to use your eyes to follow my pen. Ready? Okay, good. We're checking for any strabismus, which he doesn't have. We're going to do the cover-uncover test now. I want you to go ahead and cover your left eye. I want you to look at my nose and uncover. Okay, now cover your right eye. Do the same thing, look at my nose and uncover. Good job. We're checking for any nystagma. Okay, now the only thing we left to check for vision is the peripheral test. So I want you to go ahead and cover your left eye. Okay, and I want you to tell me when you can see my hand. Look at my nose.
I can see it. I can see it. I can see your hand.
Okay, change eyes. Okay, here we go. Tell me when you can see it.
I can see it. I can see it. I can see it.
Good job. Now I'm going to palpate the LACMO apparatus, making sure that there are no hardness or edema. Okay, any pain for you?
No.
Okay, so now I'm gonna move on to the nose. I want to make sure that it's midline, it's symmetrical. I'm gonna check for patency in each nair. So I'm gonna occlude one side. I'm gonna take a deep breath in. Okay, and now the other. Take a deep breath in. Okay, good job. So the nairs are patent. I'm also gonna look up there and check for the mucosa to be pink and moist, making sure the septum is not deviated, and looking for any lesions. Nose up, right up. Okay. Okay. Okay, I'm going to check cranial nerve number 1 by doing a smell test. I want you to close your eyes. Okay, and close one nostril for me and tell me what you smell.
Nothing.
Try again.
Peppermint.
Peppermint, good job. Okay, let's try the other side. Go ahead and close your eyes and include the other side. Okay, and go ahead and take a deep breath of this one.
Cinnamon.
Cinnamon, good job. Okay. Okay, that's it for the nose. We're gonna go ahead and move to the mouth. I'm already looking at his lips to make sure they're not cracked. There's no lesions of any kind. The corners of his mouth are intact. I'm gonna have him open up. I'm looking at his hard and soft palate, his mucosa, to make sure that it's pink and moist. There's no lesions. I'm looking at the tongue floor Go ahead and stick your tongue out for me. Hold it up. Let me see underneath that. Everything looks good there. I'm also looking at the teeth to make sure I'm counting them, making sure they're pearly white, and looking at the characteristics of them, making sure they're not chipped or eroded in one area versus the other. I also looked at the gums. I'm going to look at the tonsils and the uvula here. Go ahead and say ah for me. I checked his gag reflex there, and I wanted to make sure the uvula moves up evenly when he says ah. Okay, so now I'm going to go ahead and inspect his neck. I'm looking, just by looking at it, I'm going to make sure that I don't see any goiters on his thyroid. I'm looking to make sure it's symmetrical, that there's no masses that I can see. I'm going to go ahead and palpate his carotid artery, one side and then the other. Okay, making sure that they're symmetrical. I'm going to palpate the trachea, making sure that it's midline and that it's movable. I'm also going to go ahead and palpate the thyroid. Okay, go ahead and swallow for me. Okay, I should be able to feel it in between my hands, which I do. There's no nodules that I can feel. But you know, by looking on the front, I can also see that there's no nodules that I can see. Okay, I'm also looking for jugular distension, which I don't see. We're going to go ahead and do a passive and active range of motion. So I want you to tilt your head back and forward. Okay, look side to side for me. Okay, how about like this? Okay, good job. Now I want you to push against my hands. Good job. Okay, and then turn your head against my hands. Good job. Okay, we're also going to check cranial nerve 11 by having him shrug his shoulders. Okay, now go ahead and shrug your shoulders again. There you go. You pushed up against my hands, so it's intact. Okay, so now I'm going to go ahead and auscultate the carotid arteries. I want you to go ahead and hold your breath for me. Okay, you can breathe and do it again. Good job. I'm also going to auscultate the thyroid, making sure that I don't hear any thrills or bruits. Okay, I'm also going to check the lymph nodes. We're going to start with the occipital. I'm going to go to the pre and post auricle, the tonsillar, the submandibular, the submental, okay, supraclavicular chain, okay, the post subclavicular chain, and the deep clavicular chain. Okay, I'm also going to check for the supraclavicular and the infraclavicular. Then I'm also going to go ahead and check for the axillary while I'm here. Go ahead and rest your arm on my, okay. I'm checking for any masses, hardness that might be present. Okay. We're going to go ahead and look at your upper extremities. We've already looked at the shoulders, the arms. I'm looking at the hands, the nails. I'm looking at the skin, making sure there's no rashes or lesions. Looking at muscle tone to make sure it's equal on both sides. Looking at the nails to make sure there's no clubbing, no stenosis, no, gosh, I don't know. Sorry, no rigidness in his nails. I'm going to go ahead and check capillary refill. It's less than 3 seconds. Okay. Now I'm going to have you turn to where your legs are facing over here. I'm also going to check on his arms his brachial pulse and his radial pulse. And then we'll check his radial or his brachial reflex. Okay, so now we'll move on to the back. So starting in the back, I just like to look at the skin here, making sure that there's no skin discoloration, there's no lesions or any bumps that might be concerning. Okay, I'm going to check down the spine, making sure that it's straight. I'm going to percuss systematically from side to side, listening for resonance. We shouldn't hear hyperresonance or dullness. Okay, I'm going to check for tactile firmness. So when I put my hands on your back, you're going to say 99 each time, okay?
99, 99, 99, 99.
Okay. I'm also going to go ahead and check for diaphragmatic excursion. So let me get my tape measure. Okay, I want you to take a deep breath in for me, and I'm going to percuss. Until we get to dullness. I'm going to mark it. Okay, and then I want you to go ahead and let it out. Take a deep breath in and let it all the way out and hold it. Let it all the way out and hold that. Okay, again, marking that. I'm going to measure it. It should be 3 to 5 centimeters. His is 4, so that's perfect. Okay, I'm going to check for expansion. I'm going to go to T10. Okay, and I want you to take a deep breath in for me. My hand should be expanding at the same time, symmetrically on both sides. This will help me to know if his lungs are expanding together. Okay, I'm also going to go ahead and percuss laterally since I didn't do that already. Go ahead and raise your arm up for me. Okay, other side. Okay. I'm going to auscultate his breath sounds in the back. Go ahead and take deep breaths for me, in and out. Okay. Again. 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 Okay. So I'm going to have you go ahead and turn back around and face the front. Okay. So now I'm going to start with inspection in the front again. I'm going to look, make sure the hair is evenly distributed. I'm looking for any discoloration, any rashes, any lesions, any difference between one side to the other. I'm checking for symmetry. I'm going to go ahead and percuss the anterior chest. Okay. Now I'm going to palpate the chest wall. I'm going to check the pericardium. So first I'm just going to palpate down, making sure that there's no masses. Okay. Then I'm going to palpate the pericardium, feeling for thrills or heaves or pulsations. Okay. I'm going to find his apical pulse. Go ahead and lean forward a little for me. Okay, we're also going to do tactile fremitus in the front. So again, when I put my hands on you, you're going to say 99.
99. 99. 99. 99.
Okay, good. So now I'm going to go ahead and auscultate his breath sounds. So again, when I put my stethoscope, go ahead and take a deep breath in and out. Okay, now I'm going to go ahead and auscultate his heart sounds. I'm going to start with the aortic, which is second intercostal on the right sternal border. Okay, pulmonic, which is on the second intercostal left sternal border. Ebbs point, which is the third intercostal left sternal border. Tricuspid, which is the fourth intercostal left sternal border. And the mitral, which is the fifth intercostal midclavicular line. Okay, we're going to go ahead and have you lay back. I'm going to actually have you sit up for a second. I'm going to lay this back a little further. Okay, go ahead and lay back now. Okay, so now I'm going to be inspecting his abdomen. I'm first just going to look at it. I want to look at the contour of it, making sure that there's no bulging areas, that it's either round or flat. I'm looking at the hair distribution again. I'm looking at the color to make sure it's even. There's no rashes, no bulging, which I think I already said. So I'm going to auscultate the bowel sounds in all four quadrants. Okay, now I'm going to auscultate the arteries in his abdomen. I'm going to start with the aortic. Now the renal arteries. And the iliac. And the femoral. Okay, I'm going to percuss his abdomen. We should hear tympany. Okay, I'm going to find his liver border. I'm going to start mid-clavicular line here in between his intercostals, and I'm going to listen for dullness. And again, I'm going to mark that. Okay, then I'm going to keep going. So go ahead and hold your breath for me. Listening for dullness. Okay, I'm going to mark that. And let me get my tape measure here. This should be anywhere from 6 to 12 centimeters. His is 8, so that's perfect. Okay, now I'm going to percuss his spleen for dullness. Go ahead and hold your breath for me, sorry. Okay, I'm going to start palpating his abdomen. I'm going to start with a light palpation and then do a deep palpation. checking for any masses, any tenderness for the patient. Okay, I'm going to do a deep palpation now. Okay, I'm going to go ahead and feel for your liver border, so I want you to hold your breath. Okay, it should be smooth. No, it shouldn't be jagged or hard. Okay, go ahead and breathe. I'm going to do the same for your spleen. Go ahead and hold your breath. And I really shouldn't be able to feel this spleen. If I did, it might indicate that it's enlarged. Okay. I'm also going to go ahead and palpate his kidneys. Okay, any pain with that? Okay. I'm also going to palpate his aortic for any pulsations. Okay. I want you to lift your head up off the bed. I'm looking at his abdominal muscles, making sure they're symmetrical, there's no bulging present. There's not. Okay, I'm going to go ahead and have you sit up. Okay, I'm going to go ahead and inspect his legs. I'm first just looking at them. I'm looking at the muscle tone. I'm going to feel them for temperature, making sure they're not diaphoretic. Looking at the hair to make sure it's equally distributed. I'm going to go ahead and check for muscle tone. So I want you to push against my hands. Okay, do it again this way. Same thing, pull back on your legs. Okay, push forward. Okay, same thing with your feet. Pull your toes up. Okay, push them down. Good job. I'm going to check his pulses. We'll start with his popliteal. Okay, and I'll do his dorsal and his posterior tibial. Okay, I'm also going to check the reflexes in his knees. Okay. Okay, I'm going to have you stand up. Okay. I want you to turn this way. I'm going to check his back, make sure that his cervical and lumbar spine are straight. Can you go ahead and bend over and touch your toes for me? Okay, bend over and touch your toes and stay there. I'm going to just check his vertebrae. I'm going to feel each one, making sure that they're not tender for the patient, making sure that they're not sticking out. Okay, that's good. Go ahead and stand up. And can you turn and face me? I want you to squat down. This is checking for upper leg strength and balance. Okay, did good. I forgot to check one thing on you. Go ahead and have a seat back up here facing this direction. Okay, I forgot to check your joint here. Actually, I just want to quit. Okay, I'm done.
We have it all.